Assessment: headaches, AO joint stuck in extension on one side and decreased mobility. This is the AO joint, and we're kind of going back and forth. So when you go like this, the other thumb comes off. You go like that, like that, like that, like that. Hands on, off. Hands on, off. So you're asking to open and close. Close, open. Close, open. Close, open. Okay, you want to pick up your client's head, rotate it to one side, and you go to the first barrier. And my hand's under here safely. And then you have her tuck her chin. And then you want to have her rotate back out against your resistance. 1, 2, 3, 4, 5, let go. Have her push against you. 1, 2, 3, 4, 5, let go. Go to the next.